Good afternoon to you all. I am Dr. JP Singh. Welcome to today's discussion. The topic for today's discussion is euthanasia, present and the future. Firstly, we should discuss what is euthanasia or mercy killing. It is derived from a Greek word which means good death. As we say, good life. For euthanasia, it is good death. And it is described as producing painless death of a person suffering from hopelessly incurable and painful illness. It is incurable at present. This word is at present, incurable at present, and painless illness, painful illness. Hence, we go for euthanasia for the individuals. The types of euthanasia are the active euthanasia or the passive euthanasia, voluntary and non-voluntary. Active euthanasia versus passive one. What is active euthanasia? The first line says it is positive, merciful act to end the meaningless suffering. It is positive act to end the meaningless suffering, whereas the passive euthanasia says it is not using external life-sustaining measures to prolong the life. Here it's an act and here not using. So by saying this, the active euthanasia becomes an act of commission and passive euthanasia becomes an act of omission. Hence, in omission, we are not doing something which is required, and in commission, we are doing something which is not required. In active euthanasia, for giving active euthanasia, we give drugs to slow or stop the life. There are few drugs which we all know which stop or slow the process of life, if we keep giving them continuously. Whereas in passive euthanasia, it is not performing resuscitation acts to save the life. Again, act of commission, administering drugs, an act of omission, passive euthanasia, not performing resuscitating measures to save the lives. In active euthanasia, we use measure to hasten death, whereas in passive euthanasia, we are not using measures that would delay the death. Right? We are not using any external agent in passive euthanasia which will prevent the death of the individual or which will delay the death of the individual. And passive euthanasia is the only type of euthanasia which we practice in India, and we do not practice active. Now, voluntary versus non-voluntary euthanasia. It is the in voluntary euthanasia. During voluntary euthanasia, the individual requests either during illness or before, either during or before the illness, if he is suffering from complete incapacitation during that course. If he is suffering from complete incapacitation and he cannot express, that time he has already written a request or he has already requested for euthanasia. Whereas during non-voluntary euthanasia, the individual is incapable of perception of and feeling, right? And hence cannot distinguish between life and death. Therefore, cannot give consent. Here, the individual is consenting, consent present, and here, consent absent, totally absent, right? So, this is the difference between voluntary and non-voluntary euthanasia. Arguments against euthanasia. As we all know, there are few individuals who go for the topic or who go against the topic. Same here in euthanasia, there are groups who are against the euthanasia and there are groups of medical professionals who promote euthanasia. So when those who are against euthanasia, they say it is against medical ethics. Very true. As a doctor or medical practitioner, we practice to enhance or promote life or to upgrade the life. Whereas in euthanasia, we try to stop the life and promote the painless death of the individual. We all know the medical science is a ever progressing branch. It is very true. It is a ever progressing branch. And the disease which is incurable at present may be curable tomorrow. But in tomorrow when? What is the time frame for this tomorrow? It is after few months or few years or few decades. That means it is a questionable. This line is very questionable. It may become curable tomorrow, but we don't know what is the time frame. Euthanasia not only for the terminally ill, but may be used for committing murder. Yes, it is one of the side effects of euthanasia that it may be used by some family members or friends or antisocial elements for committing murder or promoting death of the individual who may be saved. It may be used by doctors coming hand in gloves with relatives. Again, these two go hand in hand and can become a mean of health care cost containment. As we all know, in an era of commercialization and limited healthcare resources, it may become a mean of healthcare cost containment on the individuals where there is no hope of getting a return of the resource. And last is it may become involuntary. It may become involuntary for those patients who are weak, old, or very young, where they cannot give consent in that state. Hence, it can be practiced by the doctors or the family members or near relatives to promote euthanasia and get advantage of the situation. For those who go for euthanasia, who are promoting euthanasia, they say for those individuals who are suffering from unbearable pain, they need a dignified, painless death. Why to promote their death? Why to promote their painful situation? Hence, should be given a dignified, painless death. There are situations, and there are situations where the family financially may not bear high cost of medical treatment, and they are not fully satisfied with the with the patient and the condition he is suffering from, that he may be cured in near future. In such a condition, they go for euthanasia and not forced to stay alive. In such situation where the individual is suffering from a incurable disease and there is no hope for cure in near future, or there is no hope that he may be a normal person in near future, we should not force the person to stay alive in that situation. Hence, these are the reasons for euthanasia. So now we go ahead. Nota bene means note few things. There are few important things for this topic we should note. It is the Supreme Court, it legalized passive euthanasia in certain situations with approval of High Court. So here law and medicine both are involved. The Supreme Court allowed an individual to draft a living will. What is living will? We'll discuss it in a little while. Advanced medical directives, they are given by the Supreme Court and which are issued and executed by relatives and next friend of the terminally ill person. The next friend comes in picture when there are no near relatives or the known person of the terminally ill patient. Hence, a medical board will be formed by the hospital on the directives of the court, and they'll take the final call. A family member or a friend of the terminally ill person can go to High Court, on the directives of which a medical board will be constituted, and it will decide if passive euthanasia is needed in such a case or not. And they'll submit their report to the court. The curious case of Aruna Shanba. These directives came after this case. This case happened in 1973. She was a nurse at KEIM Hospital, Mumbai. She was abused and assaulted by hospital staff in 1973. After the episode, she suffered brainstem and cervical cord injury and went into a vegetative state till her death. In 2010, the historic year, the Supreme Court admitted a petition by Pinky Virani, she is a social activist, to withdraw the life support given to her and based on the medical report from the hospital. 1973 to 2010, almost 37 years. Almost after 37 years, someone filed an application in court to withdraw the support, citing the vegetative state of the patient based on the medical report from the hospital. After 1 year, the court directed a three-member medical board to be concluded, and the report said the patient was not brain dead, but met most of the criteria of being in permanent vegetative state. Here, two things are important. One is she was in permanent vegetative state, but she was not brain dead. So we'll say those who are in vegetative state, they may not be brain dead, but those who are brain dead, they are in vegetative state. In March 2011, Supreme Court issued guidelines legalizing the passive euthanasia. In 2011 March, Supreme Court legalized euthanasia and permitted withdrawal of life-sustaining treatment in patients not in position. In patients who are not in position to make an informed consent. It is for those patients who cannot make an informed consent. For those, passive euthanasia can be done. The decision for the passive euthanasia must be taken by parents, spouse, or other close relatives, or in absence of all of these, by next friend, and also required approval of the court. So we need approval. The decision taken by parents means relatives, or next friend, or then followed by medical board report. Then this all goes to High Court. Intervention of the court. Approval of the court is required in such cases. For the present case, in Aruna Shanbhag case, the court rejected the petition, declining to recognize her as next friend and treated KEM hospital staff. All the nurses are staff who were treating the Aruna in the hospital since 1973 as the next friend. These all staff, they went against the appeal and they said that we'll take care of the patient till the death. In 2014, another historical year, in 2014, Supreme Court admitted inconsistencies. Supreme Court admitted inconsistencies in the earlier verdict, including the one given in case of Aruna. So, Supreme Court said the verdict given in 2011, it was not very clear and referred the PIL by the NGO, which allow terminally ill person to execute a living will. Again, the term living will is here for passive euthanasia to a constitution bench. The case was referred to the constitution bench for passive euthanasia based on living will. So what is living will? Aruna died of pneumonia in 2015 after almost 42 years in a persistent vegetative state. Living will, it's a document by way of which a person can give his explicit instruction in advance. This is important. In advance about medical treatment to be given if he is terminally ill or not able to express informed consent. That means an individual, when he is well oriented and healthy, can write a document by means of which he is giving instruction about the medical treatment to be given to him in future if he is terminally ill or not able to express his consent. That document is living will. In 2018, Supreme Court recognized living will. It is acceptable. The Supreme Court accepted the concept or the document living will and laid down the procedure to adopt it. Why again we are discussing this concept of euthanasia here? Because of this news which has come up recently about Harish Rana. Harish Rana. Comparing with the case, we will go through the document. Comparing with the case of Aruna Shanbhag, the advocate Bhati told Supreme Court that the medical condition of Harish Rana, who has been in vegetative state for last 13 years, is worse than Aruna Shanbhag. Right? Why it is worse then? We'll go ahead and see why it is worse than Aruna Shanbhag, and favored his plea for passive euthanasia. Advocate who is appearing for the center said Shanbhag, who died in 2015, Shanbhag's eyes would respond and she also used to move her lips to lick sugar. So we said she was in a vegetative state but not brain dead. That is why she was able to move her eyes in response and lick sugars. But in case of Harish, he has been in a state of complete inertness. He is not responding from eyes or lips or any other way in any sense. His eyes do not move nor respond to danger. That is the last thing. They are not moving, not responding. Advocate Rashmi, she said he had been suffering and he had been in an irreversible and incurable state for last 13 years with 100% disability. This thing has come after the medical board report of a medical board. Since the accident, he suffered an accident and he is in a state of irreversible, incurable condition, suffering 100% disability with no hope of recovery. With no hope of recovery, the court, they also requested the court to proceed and make a final decision on withdrawing the life support of the individual so that we can reduce his suffering and give a painless death. The court reserved its order, and after hearing both the sides, this is the first case after 2015. This is the first case of its kind that when the court will decide a plea for passive euthanasia, we all are waiting and looking at the court what they'll say. Hence, I'll request you to keep a note on the news about Harish Rana and the euthanasia. If you like the content, please write in the comment box. Please like and subscribe our channel. Thank you for your patience hearing. Thank you.